is part of social withdrawal. Their moods are very irritable and they're very angry. They could feel overwhelmed. You'll notice anxiety, fatigue, sadness in general, which could be looked at as hopelessness and emptiness. Some of them may have even change in appetite and of emotion we feel. If there are any signs of suicide or self-harm, that is definitely linked to depression. So I've not put this on the slides, but just something maybe we can quickly talk about is the clinical diagnosis for what we refer to in psychology as major depressive disorder. And a lot of the symptoms that have been mentioned here would need to be persistent for 2 weeks in order for them to be clinically diagnosed. So we are talking about depressed mood for most of the day, almost every day, feelings of sadness and emptiness and hopelessness, irritable mood, anger, irritability, annoyance. If they show diminished interest in pleasure in all activities, if there's weight loss or weight gain, as we've mentioned, and this is more in terms of a noticeable change, maybe more than 5% in a month, either weight loss or weight gain, that's of concern. If there's a decrease or increase in appetite, as we've also mentioned, problem sleeping, so insomnia or hypersomnia. So either sleeping too much or too little, that's something you need to look out for. Fatigue, loss of energy. If you notice that their self-esteem is low, they're feeling worthless or guilty about something, and if they become socially withdrawn, these are all the symptoms that you need to look out for. And yes, thoughts of death. If they start talking about life not being worthwhile, some of the things to look out for. Okay. Sorry, is there somebody who wants to say something? Okay. If at any point anybody has a question, or if they would like to ask something or share something, please feel free to interact. We would like this to be an interactive workshop, so please do feel comfortable to do so. So here are a bit more detailed symptoms of depression in adolescence. Okay. Let's look at the emotional changes first. So as we've said, feelings of sadness. So they could be sitting and crying for a really long time for no apparent reason, just feeling sad in general, and they don't know themselves. Frustration or feelings of anger, even over very petty things, small matters. If they feel hopeless or empty, irritable or annoyed, and like we've said, if they have loss of interest in usual activities. So when we say loss of interest, it's something that they would have found pleasurable before, something they would have enjoyed to do before, and then suddenly they do not enjoy doing those activities anymore. Loss of interest in or conflict with family and friends. So somebody who is socially withdrawn and who just does not want to see anyone or socialize with anyone. Someone who's feeling low in self-esteem. And this can include feelings of worthlessness or guilt. If they're fixating on past failures or they exaggerate self-blame or self-criticism for things that just do not make sense. When they are extremely sensitive to rejection or failure and the need for excessive reassurance. When you notice that they have trouble thinking, concentrating, making decisions and remembering things. And if they have an ongoing sense that life and the future are grim and bleak, which is linked to having recurring thoughts about death, dying, or suicide. So those are some of the symptoms of the emotional changes that they will experience if they are struggling and showing symptoms of depression. Some of the behavioral changes, which most we've mentioned, the tiredness and loss of energy, the insomnia or sleeping too much, the changes in appetite, increased cravings for certain foods, or loss of appetite, the use of alcohol or drugs, which has become a reality for most of our youth. Agitation or restlessness. This is what we talk about when we say irritability. So, for example, the pacing, hand-wringing, inability to sit still, slow in thinking or speaking or bodily movements can also be some of the behavioral changes experienced from depression. If they suffer physically with body aches and headaches, which seem to have no biological basis, and you find that they are having frequent visits either to a school nurse or you have to keep taking them to see a doctor or a physician. Social isolation, they don't want to socialize. They may have enjoyed going out before with friends or attending functions, and now they seem to not want to. Poor school performance or frequent absences from school is another sign of a behavioral change in a depressed adolescent. Noticeable changes in appearance. So you can notice that they are taking less interest in themselves, less attention to personal hygiene, neglecting the way that they look on the outside is another change to look out for. Angry outbursts, disruptive or risky behavior, or other acting out behaviors. So this often happens in adolescence, especially when it is with children who normally would behave really well and they start behaving in a completely strange and unfamiliar way. Self-harm, for example, cutting or burning. And there are situations and cases where some of them are very depressed and have not been attended to, and they actually begin to make a suicide plan or they attempt suicide. Okay. Sorry, I'm just going to check the chat quickly to see if there is anyone with any questions. Okay. We'll move on to the next slide. So what are the causes of depression in adolescence? Normally, that's the way to resolve a situation, right? Is if we know the root cause and we cure it, we can prevent it from happening. But unfortunately, the cause of depression in adolescence is unknown. But there are several factors that could contribute and influence the onset of depression at this stage of life. So we look at the brain chemistry. Neurotransmitters, which are naturally occurring brain chemicals that carry signals to other parts of our brain and body. When these chemicals are abnormal or impaired, the function of nerve receptors and nerve systems change, leading to depression. So we're now talking about the biological cause of depression. And normally, for those that do suffer from a biological cause, it would need to be addressed with medication prescribed by a qualified professional. Hormone changes. This is the time when teenagers are going through so many different changes, physically, emotionally, mentally. Changes in the body's balance of hormones could be the cause or could trigger depression in teenagers. Inherited traits. We talk about genetic factors here. Depression is definitely more common in people who have had relatives, such as parents or grandparents, who have also suffered from the condition. Early childhood trauma, one of the main causes that triggers depression in adolescence. Traumatic events during childhood, such as physical or emotional abuse, maybe even the loss of a parent or a loved one, may cause changes in the brain that risk the risk of depression, and they may even trigger them emotionally. And then there's learned patterns of negative thinking. So we're looking at depression from a cognitive perspective now in adolescence, where the youth may be linked, depression in youth may be linked to learning to feel helpless, a learned behavior. Instead of learning to feel capable and learning resilience, they begin to learn negative thought patterns. Let's look at some of the risk factors for depression in adolescence. So, what increases the risk for depression? Having issues that negatively impact self-esteem. Okay, so we're looking at things like obesity, peer problems, long-term bullying, or academic problems. Our youth are faced with immense pressure at this time of their lives, especially in this day and age. Technology is so advanced. Everyone is trying to live their best life. Everyone is trying to live up to everybody else's expectations. And this can have a very negative impact on a teenager's self-esteem. Academically, a lot of pressure again on our youth. Competition is so high to get into universities, into schools, into colleges. They have to perform their best, which could increase anxiety and eventually depression. Being the victim or witness of violence, such as physical or sexual abuse. This could also increase the risk of depression in an adolescent. Often, if we have children that have grown up in dysfunctional homes where they've witnessed violence, family abuse, physical abuse, sexual abuse, this can definitely impact them and can trigger depression during the adolescent years. If the teenager is suffering from any other mental health condition, such as an anxiety disorder, bipolar personality disorder, an eating disorder, and even disabilities such as ADHD, these all put our youth at a higher risk for depression. If they have any ongoing pain or chronic physical illness, such as cancer or diabetes or asthma, they are an increased high risk for depression. And then we have certain personality traits, such as low self-esteem, or being overly dependent or self-critical. And we do have a lot of our young people like this. And if we are not careful and if we do not provide the right support, they are also at risk for depression. Abusing alcohol, nicotine, or other drugs. At times, these substances are first begun due to social interaction, right? As a teenager, you may try to smoke or try certain drugs or try to take alcohol in socially, just for fun, just to fit in. But what happens is we become dependent on these substances, and without them, we become depressed. And even with them, it affects us biologically, it affects our bodies, it affects our minds, it affects our deen, our spiritual side of everything. And we find ourselves feeling depressed. We're not grateful for what we have anymore. And then there's being of a certain religious practice. So as young Muslims in this day and age, it is difficult at times, depending on your environment and whether you fit in or you don't, whether you're being bullied, whether you're being ostracized, dressing a certain way because of our religion. It can be really difficult for our youth to try and practice their religion safely without any judgment. And this puts them at risk for depression as well during the adolescent years. Family risk factors. So as we've mentioned, having a parent or a grandparent or a blood relative who has suffered from depression or bipolar, or even uses substances, they are also at risk for developing depression. At times, having a family member who died by suicide can also affect the risk of having depression. Family with major communication and relationship problems. So we're talking about the psychosocial side of it now, which includes experiencing stressful life events such as divorce or, like we've said, death of a loved one. These all put our teenagers at risk for depression. So what happens when we do not treat depression, when it goes untreated, especially during the teenage years? So untreated depression results in emotional, behavioral, and health problems that affect every area of your teenager's life. When we do not treat depression, our youth begin to use unhealthy coping mechanisms to try and make themselves feel better. We're talking about alcohol, drug misuse. They begin to do poorly in school. They have academic problems. Family conflicts and relationship difficulties increase. And then we look at suicide attempts or suicide. And some of the related conditions and illnesses that may occur later on in adulthood or may even begin during the teenage years. Eating disorders, multiple sclerosis, suicide, substance use, Cushing's syndrome, Huntington's disease, Parkinson's disease, hypothyroidism, strokes, things that I think most of us wouldn't even relate to depression. But they are very much related to depression, and depression could be a prerequisite for them to occur. So before we carry on, I just want to ask, does anyone have anything to share, or are there any questions? I'm just going to give everybody a couple of minutes. If there's anything to share or anyone wants to ask anything, please, you can go ahead.
Can I ask something?
Yes, sister, please go ahead.
I just wanted to ask if the parents aren't very understanding people who don't listen to the adolescent, then could it be possible that the child is not able to speak what she really feels or thinks, and that could be the cause why she is eating too much, and that would lead to an overweight, like an obesity, and that would be a way of going to depression, maybe? Could that be something? Yeah.
Okay, so I just want to make sure I understand your question.
Yeah,
You're
it was
saying
very complicated. I'm sorry.
no, it's fine. Not a problem. Thank you so much for participating and for asking. So let me just make sure I understand correctly. You're saying if the teenager is not able to communicate effectively with the parent, is that what you're asking? And they feel that they can't have an open communication and they can't speak about how they're really feeling. And then they begin to rather overeat, and have an obesity problem. Is that correct?
Yes.
So yes, absolutely. it's actually I think in the next slide. Communication is definitely one of the key things, one of the key aspects in making sure that our children do not end up in a situation where they will be suffering from depression. And you're right in that the teenager may have felt that she couldn't speak or he couldn't speak about how they were really feeling. And so, like I mentioned, they find an unhealthy coping mechanism, which is the overeating. They find comfort in the overeating, and it's their way of coping with whatever they're feeling. And that will definitely lead to depression because they're going to overeat and they're going to become obese and they will not be happy with the way they look. They will most likely suffer from health issues because of the overweight and because of the obesity. And it's a cycle, a vicious cycle. And they will begin feeling sad about themselves and depressed about themselves and about the way they look, about the way they feel, about their health issues. And so it definitely can lead to depression, definitely.
Okay. Thank you very much.
You're welcome, sister.
I want to ask something.
Yes, sister.
First of all, can you tell me the age of adolescent? What is the age?
The age. So adolescents, we're looking at children between the ages of 12 to 19. That is usually the age range of adolescence.
Okay, that is also the age range of teenage, no?
Yes, yes.
Achha. I want to ask another thing, that I know someone very close that she used to suffer from these all symptoms
Okay.
when she was young, but now she's married and she's now 23 years old. So is there any chance that she can have these symptoms going on with her right now as well?
Yes, if she did not get it treated, if she did not seek help, or if she did not find a way of coping, a healthy way, she could still be suffering from these symptoms or from related symptoms.
And it would affect her kids as well.
It would affect her kids, not in the sense that they are definitely going to have depression. You'd have to check and make sure that there aren't any genetic factors involved. But you might find that those that do not address these issues and do not treat these issues of depression during their teenage years, they may have other issues as they go into adulthood, other complications, and it may affect the children in their environments in a social way, in a psychosocial way. So somebody who has not treated their depression during their teenage years may end up getting married, for example, and they are having problems with their husband or their wife because they did not treat the root cause of their problem. And then the children grow up in an environment that is full of conflict, in an unhealthy environment. And then they begin to find unhealthy ways of coping as well. I don't know if that makes sense to you, sister.
That makes a lot of sense to me, because I have my mother. She's like 50 now, but she went through childhood depression, and in Pakistan, mental health is not recognized as an illness. It is recognized as it like the person doesn't want to work, or the person is just making excuses. So I know like how does it feel, but my little sister, she's 22 years old. She used to face most of the problems you suggested. So that is why I was asking. And Jazakallah.
Barakallah feek, sister. I hope that helped. But yes, to answer your question, if untreated during the teenage years, depression definitely can continue to have complications into adulthood, and it definitely can affect those around the person in a negative way. There's a sister who's raised her hand. Please go ahead.
Assalamu alaikum warahmatullahi wabarakatuh. Thank you for giving me the opportunity to ask. So what I wanted to just add is that to Sister Zainab's question is, yes, absolutely. Our cultures is one among the huge barrier that we are not able to not diagnose. Diagnosis is still later on. It's even just acknowledging there is an issue with mental illness, because if, let's assume, a child starts disassociating with their parents, it's kind of saying the child, from an Islamic perspective, is already on a wrong track. So rather than tagging a person, a child who is fairly just learning about him or herself and the environment, and we are not giving him him or her the space, does make it difficult. And it's not just right now, because I'm seeing kids around, it's not just the adolescent's age, it's actually the depression has started kicking in way earlier, as age as 5 and 6. And it's depressing for us as well to see kids in these conditions. It's difficult, but I would say that we all have, like, as facilitators, as counselors, as people who are looking into making someone's life better, with the hope that, yes, inshallah, it would be better, is that we have to work as a community. As Sister Zainab says, that in Pakistan, it is not accepted. But it's not just Pakistan. Trust me, that happens in Japan, that happens in China, that happens in the Middle East. The moment a guy says that, Mom, I'm feeling low, and the mother says, Yalla, go pray 2 rakat salah, you'll feel better. Rather than sitting down, saying that, my child, let's talk about it. What is it that is bothering you? How can I help you? And sometimes they are not even looking for solutions. They just want an ear to listen to. Thank you very much, sister. Jazakallah khair.
Thank you so much for sharing that. And that is exactly it. That's what it is. When the sister had asked about what ages the adolescent years are, yes, they are 12 to 19, but like you say, we find that the younger children are already suffering from depression. And why is that so? It's the world we're living in. You know, our children, unfortunately, have so many challenges to face as compared to what we had to face. There is this culture of instant gratification and comparison of lives to one another. Like I had mentioned, everybody's living their best life. So the children are growing up with that mindset. And it is not teaching them resilience in any way. And for us as parents, we need to change with the times. You know, yes, religion is something to rely on when it comes to mental health. But it's not the only thing. Like you say, sometimes our children just want support. They just want to be heard. Most children just want to be heard. You know, they just want to be able to feel supported and loved and valued, and that they can share what they're going through with somebody close to them and somebody trusted. And so this is how we help. And I have not put this on the slide, but how we help is we need to change the narrative. I'm so sad to hear that in Pakistan, mental health is not considered an illness, and that this is the belief and the culture in the country. And like you're saying, in other countries, it's the same. And we need to change that. We as parents, we as caregivers, we need to change that. So how do we help? We provide support. We be a good listener. We encourage open and honest communication. I cannot stress on this more. It is so important in this day and age, with social media, with the internet, with everything happening around us, everything so easily accessible, for us to be open and honest in communication with our children. We need to change cultural barriers. Things that we were brought up to believe that were taboo to talk about. We need to be talking to our children about it. Rather they hear it from us with the right information than to go to the wrong sources and get misinformed. Encourage your teenager to take steps to control stress, increase resilience, boost self-esteem, and handle issues when they arise. And this is our job to help them to do this. We talk about practicing mindful self-care, for example, by creating a healthy sleep routine, using electronics responsibly and in moderation. So self-care, I know culturally, especially as women, this has been something that we've never ever had to learn. We were not taught this, but it's something we now need to take heed of. Sorry, sister, is it Tamina? You had your hand up. Please, can you share?
Yes, I had. Then I realized that I didn't want to interrupt, and so I lowered my hand.
Please.
I also
No,
wanted to
please, go ahead.
say, thank you, Jazakallah khair. So another thing that I wanted to, and this is one way I dealt with few of my students and parents at work was, so I had a parent from, I'll not be very specific which country, but they were from the Middle East for sure. So I was having this, I was trying to have a healthier conversation with the parent is that, counseling is needed. Like, and there, the moment the word counseling came into the context, it's taken out of context in multiple ways. So for example, the parent actually did say, are we mental enough? You think I'm a retard, I should go for counseling. And I had paused and I said, are you aware that our Prophet Muhammad sallallahu alaihi wasallam with all the Sahabas, they were counseling each other consistently. Every single matter was discussed.
Yes.
And this is something we have forgotten, because if for me as a person, telling to a parent was because the parent was complaining about his son. So for him, according to him, and these are his words, and I quote, is he not a man enough to deal with his situations and emotions? What has he got to do with mental illness? My response was to him is, it is not a matter of he's a man enough or not. When a Nabi can cry, who are we to say that a man should not shed tears? Let's be open. Let's listen. Let's talk. Because if we keep giving them these kind of statements, they are not going to come back to us. They will start shutting us down.
Exactly.
That's in addition, a personal experience for me was when my daughter started going, I transferred her. She is 9, but this incident is way before she was 9. She was 7. And subhanallah, out of the sake of love, she wanted to start wearing hijab. I'm this person who would not impose on it. I would say, if you believe that you should be wearing it, wear it, say Bismillah, but then stick onto it. Do not remove it for any other person other than for the sake of Allah, which you will have to question. Now, this is a very young, early age, and the tender age when your mind is completely just either grasping, rejecting. So one day she comes back from school. She says, Mama, I'm tired. I hate the way the kids treat me at school. And I said, why is it, my child? And she says, I'm getting bullied because I'm wearing hijab. What should I do? And I said, good question. Let's take it this way. If you remove your hijab for today, for the sake of someone, tomorrow they might come back to you and say, you know what? You look ugly in a skirt. The third day, they will come and say, you look ugly and pathetic with this leggings on. The fourth day, they would come and say, you look disgusting in t-shirts. What are you going to do, Reem? Are you going to go naked? And she was like, no, absolutely not. That is so shameless. I said, exactly. We all should be mindful that we do not want to be in a shameless position in front of Allah subhanahu wa ta'ala, because after all, we are answerable for each and every single action. Jazakallah khair.
Barakallah fi. Absolutely, sister. Thank you for sharing that story with us. And that is the perfect example when we talk about increasing resilience and boosting self-esteem in our children. It's exactly that. We are the safe space, and we need to be the foundation for them to grow in their self-esteem, to know who they are as Muslim children, to be resilient towards all of these outside influences, because they are real and they are there. And where it comes to culture and this ideology of not being able to seek counseling, especially when people say there is no such thing as counseling in Islam, that is not true, and we need to push on that agenda with our communities. Counseling is very much a reality and is very much accepted in Islam. And like the sister has said, our Prophet ﷺ and his companions, you could talk about them as having group therapy every day. They sat together and shared things and spoke about things, and that was counseling in a way. And it's often that you find people will say that counseling is not accepted in Islam. And I think the mistake is because counseling has quite a lot of Western ideologies in it, and some do not coincide with our Islamic practices. So we then think that counseling is haram and that it is not acceptable in Islam. But we cannot do that. We cannot just oust the entire practice of counseling because of a few principles that do not coincide with our religion. It's the same with Islam. There are many extremists, many other people who practice things that we don't practice personally, but you cannot throw the entire religion away. You take what is good for you and you use what is good for you mindfully. The sister mentioned something about being mindful. And it's one of the key things. Be mindful. We have to teach our children this. Be mindful. Be mindful with everything that they do. Be mindful with their self-care. Be mindful with the way they conduct themselves. Be mindful in the way they are using the internet, in the way that they're using social media, in the way that they are socializing. If we give our children this basis, if we give them a strong foundation, it will help them as they go out into the world. Another thing that we do when we find that our children are struggling, or if we are struggling with some sort of issues such as depression, everyone will always say, keep it quiet. It's sort of embarrassing. It's become something to be ashamed of, that my child is suffering from depression, is suffering from a mood disorder, is suffering from some mental health issue. Whereas if we were to reach out for social support and we were to talk about these issues more openly, we would take away the stigma that is attached to these issues. Our children themselves would not feel embarrassed and ashamed of what they are going through. They would be willing to get help. Getting treatment at the earliest sign of a problem so that you prevent the depression from worsening. This is it. There is such a stigma attached to mental health in most of our communities. And what ends up happening is families don't want to admit that their teenager is suffering from a mental health issue. And then you end up in a situation where your child is self-harming or attempting to commit suicide. This is not what we want for our youth. We need to normalize seeking help. We need to normalize seeking out professionals for help, for assistance. And we need to maintain ongoing treatment if it is needed. In the same way that your child would have broken a leg or an arm and you take them to the doctor to get assisted, this is the same sort of thing. It's the same principle. Your child is not feeling well emotionally. Your child is not feeling well mentally. Take them to see a counselor. Take them to see a psychologist, a psychiatrist, whatever you feel would be best for your child. But don't just sit back and don't expect it to go away. Yes, we supplicate. We ask our Creator for help. We make the du'as. I've put a du'a there for depression and sadness. There are so many. If you were to just Google and look for du'as, if you were to just open the Quran and look for verses, Surah Ad-Du'a is recommended for depression. We could definitely turn to the Quran, but at times we need to also take action. The Almighty says, tie our camel. You don't just sit back and expect dua to be the answer. At times, because the cause may be biological, because the cause may be genetic, we may need a little extra help. Your child may need therapy. They may need counseling to help them in their way of thinking, to help change and shift their cognitive way of dealing with everything. And in extreme cases, medication may be needed, and that's okay. In the same way a diabetic patient would take diabetic medication, in the same way a cancer patient would take medication, you would do the same for mental health problems. If medication is recommended by a doctor, by a professional, there is nothing wrong with the child maintaining that ongoing treatment. it will help prevent a relapse and help prevent them from being in a worse way. Something also that we don't focus on and we don't emphasize on enough is our physical health, our eating and our exercise. So in many cultures, in many of our cultures, I'm sure fitness and exercise is not something often spoken about, and yet it's so important. If your child is beginning to show symptoms of depression, take them for a checkup to the doctor. Check their physical health. What are their vitamin levels like? Vitamin B and vitamin D, such important vitamins. Vitamin B helps with depression and anxiety and energy. Vitamin D as well, and with sleep patterns. Sometimes they may not be sleeping well, or they may be fatigued and tired because they are low in a vitamin, and that could be causing them to experience symptoms of depression. So the first thing you do is take them for a checkup, take them for a physical health checkup, make sure that they are in good health. And if that shows that they are fine, then the next steps are needed. And you need to sit down and communicate with your child, with your teenager, with whoever it is, a relative, a niece, a nephew, whoever it is, and figure out ways forward to help them and to support them. Sorry, there is a hand up. It's a Jabeen.
Assalamu alaikum.
Wa alaikum salam, sister.
Yeah, just with one thing. I mean, we can all only speak for our own experiences. But I think one point that I'd like to add is that as mums, we should never underestimate our role, because we are probably the first port of call and the ones to identify the changes that are happening in our children. So what I find is that sometimes we give all these titles around us, are the therapists and the counselors and what have you, but really sometimes that child needs a mother to connect with them first, and then to understand that, yes, of course, the next step is to go towards therapy and counseling. But until that isn't recognized by the mom and her understanding that her role to just go to the child individually and connect with them and ask them and sit with them, sometimes that's the first door to open before you even get to the counseling.
Absolutely correct, sister. Jazakallah. It's so true. As mothers, it's such a huge responsibility at times, but it is our job. It is our duty, and that is true. We need to be there. Like you said, the first port of call. A child will want a safe space. A mother is usually that safe space. I'm sure you've heard this and noticed this as well with your own children. A child will be themselves completely, whether good or bad, with their mother. They will be themselves openly with their mother and not with anyone else. And it's because they feel safest with you. I would like to say with parents in general, I would love for fathers to fit into that. I think they should, but generally it is more the mother, especially in our cultures. And like we've mentioned, sometimes they just need that environment. It's just the support that they need to feel in their home environment, because that's their home. That's the safest place for them. That is the safest person for them. And it's only when you can see that you are unable to help them, it's only when you can see that the depression is worsening, that maybe you then need to reach out for professional help. But it needs to be, we need to normalize it. With a lot of families that I've come across, seeking professional help has been something that they are not willing to do. Yes, there is a hand up. Please go ahead.
I wanted to ask if you would recommend for an adolescent that has probably depression, would you recommend us to advise them some psychologist or a psychiatrist that is not a Muslim or has works with a secular psychology? Like, I don't know, but I'm from Switzerland, and we don't have as much Muslims as other countries, as Muslim countries, and That's why I want to ask if you think that depression is something that is that could be treated very effectively with a non-Muslim psychologist, or you would recommend more having someone that is a Muslim psychologist or psychiatrist?
Jazakallah for your question, sister. It's such an important question. Something I think most of us don't realize is that there are a lack of Muslim psychologists in certain places, and it is a very good question. Is it recommended? To be honest, this is my own personal opinion. I could be corrected, but I would not recommend. I would not highly recommend a young person, a teenager, to be seeing a non-Muslim psychiatrist or psychologist, and I'll give you reasons. It's at this stage of their lives that they are influenced very easily. If it was an adult, I would have had a different answer. But because it is somebody young and impressionable and somebody who is searching for their identity and trying to find themselves, it's a little bit risky to trust somebody who doesn't have, unless the non-Muslim psychologist or psychiatrist has a good knowledge of our religion and practices ethically, whereby they are non-judgmental and whereby they would not try to influence the child in any kind of a way. But it would be safer. It would be safer to have a Muslim counselor, therapist, psychologist, or psychiatrist. It helps when it is somebody who understands the foundation of everything, which is essentially our religion. I myself, as a psychologist, have found I cannot practice without using Islam as a foundation, as a grounding tool in my practice. I have counseled non-Muslim clients, and I have been able to do that without influencing them. But it just depends. If you feel that your child needs the one-on-one face-to-face counseling and you really cannot find a Muslim psychologist, and you know that it's essential that they get the therapy, then I would say then you need to do right by your child and allow them to go. But if you can, we're living in such an amazing technology advanced world. You could find a Muslim psychologist or psychiatrist online and let them have online sessions with somebody who has the background, who has the knowledge, who has the understanding of the religion. And I think that would be should be your first option, inshallah.
Barakallah fiki.
Yes, Sister Tamina.
In addition to what Sister Salma, what you've pointed out, and again, this is with experience, I would say, and I have already spoken about it to the director of psychology in my institute. Now, what happens is, because I work with teenagers, I would say I work for a university, so you can say by judgment they are 17 and above. So what I've seen is, being in a Western institute, it becomes difficult for students to be on the track of their deen because of influences, because of peers. Now, when they are, luckily, I'm in this institute where mental health is accepted, acknowledged, treated, listened to. However, I do agree with you. It is difficult if our Muslim kids are going to psychologists who are from a Western opinion. In the most recent, I could say, is I apologize if I'm going to be upfront and going to share my opinion, because I would rather stick to the deen rather than talking something false and make you happy. I do not support LGBT.
Yes.
And from all the perspectives, I do not. However, I have kids coming up to me and they are feeling good about going to counseling sessions because they have been listened to on how, to the extent they have accepted being whatsoever it is, a non-binary or multiple alphabets they have in their LGBTQ plus. Now, from my perspective, the students do come to me as like, oh, I had an amazing session, the person listened, and this and that. I listen and I say, and they look to me. I'm a person with niqab. just to add more context. So you can imagine the dress and the students what kind of interactions I have with the students. Famina, what do you think? And I said, look, if you want me to make you happy for the sake of dunya, it's difficult. So I'm not going to be that person where I'm going to say you're doing absolutely right. No, that is not right. However, you understand, you know within your own self, talk to your heart. Is it right? Does that make you feel right? And the student says, but you know it is difficult. I say, absolutely it is difficult. I understand. I completely understand. But remember, having patience and holding on to deen makes life easier, however difficult, but it still makes easier because our intention is to make the best to the akhirah. Yes, you would be attracted to your the same gender. However, control your nafs. May Allah benefit you in the hereafter. After all, dunya is a test. Subhanallah, subhanallah. Even though with these interaction, I am not lying, the students see me every single day. So there has to be a tone of openness, acceptance, but also making sure that the truth is out there. And I say them that I make dua for you that may Allah grants you hidayah. May Allah grant me hidayah. And on saying so, when I have spoken about the deen, the child would have an instant, and this is again because from a Western influence. Oh, I have really started questioning the deen because then I'm not, I said, it is absolutely fine. Question the deen as long as you're not going to question the existence of Allah. And yeah, this is something that I will never question. This is what the child says. Okay, alhamdulillah. If you ever want to talk, I'm here. I'm not a counselor or I'm not a psychologist by profession. However, I know that my students, they do come to me. Even just if no matter how busy I'm, like, Famina, we need to talk. Sure, go ahead. Tell me how I can help you. It's just being open. Coming back to Western ideologies, I remember saying the students who, alhamdulillah, have good knowledge of Islam, however, are not able to practice 100% because of the environment that they are in, they would say, when asked by me, why don't you go and speak to the counselors? And this is their response. Famina, we did go to them, but their response to us is very Western. And I said, okay, can you give me an example? I said that my mom is not listening to me. And I said, okay. And what did the counselor say? She says, you have to make up time. Go say to them, this is important. And I said, okay, what were you expecting to listen? And they say, what would you say, Famina? I said, have sabr. You know, having respect for parents is the utmost thing we are supposed to do. So what do? Is like, mom, be as polite, be as loving, be as compassionate, no matter how difficult it seems to be. Maybe your mom is busy. Maybe there are things in the middle of the way. Just make up time. Persistence is the key. Make them listen. But you remember that, as you've already said, that you at least understand and differentiate between the Western effects or Western style of psychology or their leads versus the Islamic perspective. That's on its own is a win-win for me, being in a Western environment. So I agree with you. I can see the divide between the Western ideologies in relation to the Islamic concept, but however they do interlink. If we have that facts, if we have the knowledge, if we know how to merge, it would be just an amazing thing to have people on board who are going hand by hand, who are trying to pull kids from the dunya towards the deen, but also making sure that both are balanced, because Allah didn't say us that go, just read Quran, be in your own dome. No, that He's never said. We have to balance. So I hope, inshallah, in the near future, we have those people on board, on ground, where our kids can go to. Jazakallah khair.
Jazakallah, sister. So important to hear that, and absolutely true. And this is it. This is why I had said to the sister, I wouldn't recommend it for the reasons you've just mentioned. The Western culture has become all about accepting the nafs. It's this whole ideology of YOLO, right? You've heard this amongst the youth. You only live once, about live your best life. And it's these sort of Western ideologies that are very dangerous for our children, because Islam is not about that. We are told, Allah subhanahu wa ta'ala has told us that we will be tested. We're not going to live our best life here. This is not for this dunya. It's not for this life. We are not going to only live once. We're told this. And our teenagers can get very caught up in this Western culture and Western ideology of these notions. And it's important because, like we've said, they are confused at this stage of their lives. They are trying to find themselves. They're trying to make sense of themselves and of the world around them. And it's very difficult for our Muslim youth to be growing up in a Western environment. So they're trying to make sense of all this confusion. And at the same time, you're trying to hold them onto the deen, because you know that that is the only way that they will ever be successful, is if they keep that as the foundation. And so definitely it would be amazing if we could find that balance, like Sister Tamina has said, the balance between the Western principles in counseling and psychology together with our Islamic principles. If we could throw out our cultural nonsense and hold on to what's important in trying to get our youth to understand the balance between the two, we would definitely be so successful. Our deen cannot change. We cannot change our deen, and that our youth need to know that there are certain things that cannot change, not even for them. Yes, Sister Tamina.
I'm extremely sorry. I'm talking a lot, and
No.
please just stop me when I'm supposed to.
No,
I would
please do
say
go
that,
ahead.
thank you, Jazakallah khair. So there's one thing that, and this is not just with kids, I'm even saying with faculty, with staff. Whenever I've heard this statement, oh, Tamina, we just live once, I actually say, I beg to differ. We live every single day. We die once. Once we die, we are not coming back in this dunya. Allah gives you opportunity every single day. Go back, make astaghfar, amend your affairs. Go say sorry for the ones you've hurt. Roam around the earth. No, Allah has not stopped you. In fact, Allah says in the Quran, go explore. Go explore. Do something that is right to do so. So you are living every single day. And when they leave, they're like, okay, that's something interesting. I said, it is reality. We just are so fascinated by the quotes that someone says. We stigmatize it. We settle it in our minds, but this is the only way. There are multiple ways. Even when it is to astaghfar, Allah says, if you want to follow good, I will open doors for you. If you want to do bad, I will still open doors for you. However, you reach to a point when you want to come back to me, I will still open doors for you. It's just, this is my counter to them.
Jazakallah for sharing, sister. And you, perfect that you came in there, because I was about to mention something else that's so important, is who you surround your children with. And you are the perfect example of that for me. I was about to talk about surrounding your children with the right kind of people, having good people to influence them in their lives. Teachers such as you, alhamdulillah, we're grateful to have people like you amongst our youth. We need to surround our children with people that will be of good for them. We're told this in our religion. Allah subhanahu wa ta'ala talks about have good friends, have good companions, because they will influence you. And so surround your children, surround your youth with people that will bring goodness to them. Good teachers, good friends, good family friends. It's so important, you know, as parents and as caregivers, to make sure that the environment socially that we put our children in are going to bring goodness to them. And I know it's so difficult as parents. We get so caught up in life. We get so tired and exhausted. You know, we think, can't they just raise themselves? Unfortunately, definitely not in this day and age. A lot of the older generation tells me that parenting now is so much harder than it used to be. And it's because of the way the world has evolved. We need to be so alert and so conscious of what is happening in our children's lives. You need to know who they are socializing with. You need to know what's on their mind. This is why we say encourage open and honest communication. Make sure there is communication. Your children should be able to come to you and talk to you about anything and everything. You need to be able to listen to them with an open ear. You need to be able to not react all the time in a negative way. Handle it in a mature way Try to advise them as best as you can. So we need to look at things like this. We need to start changing all of these narratives if we are to keep our children safe and protected and in good health mentally and physically. I'm just reading some of the comments. Jazakallah to all of you for your comments. There is somebody who has said it would be amazing for us to be able to get training on this subject so that we may become the help that so many people are searching for. Absolutely true. We could definitely, I'm sure if I had to speak to Solace admin, we could definitely look into a training, a more in-depth course, maybe with a few more facilitators in doing a training course for parents and for caregivers on this, because it definitely is something important. It definitely is something we need to know more about. Is there anyone else that would like to share anything or ask anything?
I have to add, and this I've learned